Welcome to a New Human Podcast. This show is a place where we find out who we truly are and what we strive to be. Listen as we unravel current history and make our way to a new beginning. I am your host, Justin Klein. Today on the New Human Podcast, we have a special guest, Dr. Brad Brown. Brad has got a chiropractic practice up in Owine, Iowa, and he's here to share with his story what he's all doing besides just chiropractic, your normal chiropractic. And with that being said, I'm Justin Klein, the host of today's show. And Brad's going to go in here right now and start off with, how did you get into chiropractic?
Oh, it's great to be here,
Yeah.
Justin. Thanks for having me.
You're welcome.
Well, my father's a chiropractor.
Okay.
And he got into chiropractic at a later age. He was about 30 when he went to chiropractic college. We farmed up in northwest Iowa, and he'd hurt his back when he was a young teenager helping dig out a foundation. And he had chronic problems with it, and he farmed, and it came to the point where he just couldn't continue farming, milking cows and having pigs and sheep and grain. So it was either become a chiropractor or buy a hardware store. And he decided to become a chiropractor. And his brother was also looking to do something as well. And they decided to go to Palmer College in Davenport at the same time.
Okay.
So we started chiropractic college in 1960, graduated, I think, in 1963. And then moved to Owine, where he set up his chiropractic office.
Okay.
And initially, I did not want to be a chiropractor because I didn't want to just follow in my dad's footsteps because he was a chiropractor. And so I looked at becoming a war correspondent because the Vietnam War was in progress at that time. A journalist. Then I decided I wanted to be a lawyer, and but eventually I decided that no, I do want to become a chiropractor.
Yeah.
So then I went to UNI for my pre-chiropractic, and then I started Palmer College in 1976.
Is that common to do what you did there then, to go to like UNI or go to like a 4-year college and then you go to chiropractic school?
Yes, there's a required number of hours that you need to have. At the time I did that, it was 2 years of pre-chiropractic with special classes.
Okay.
And now most states all require a 4-year degree before you go to chiropractic college. Chiropractic education is a 4-year degree. So that's when I started in 76 and I graduated in 79. And another interesting thing, I believe, is that my father's brother went to school with him. A couple of years later, another brother followed him to Palmer College, and a year later, another brother followed. So 4 brothers that were all farmers in northwest Iowa decided to go to Palmer College.
Which is in Davenport.
In Davenport.
So did they all scatter around Owine area then, or is that why you came to Owine?
No. They set up in Owine. I think he did that because I think he was scouting out to buy a hardware store here, and that's what set him going to Owine. Either that or else he drove through Owine on the way back to Esterville.
Okay.
But one brother set up in Cherokee, Iowa, ended up moving to Colorado. Another brother set up shop in North Dakota because he liked to be around the hunting and fishing. The first brother in Colorado liked mountain climbing and skiing, so he went that direction.
Yeah.
The other one went to North Dakota for hunting and fishing, and then the youngest brother went to West Union originally and then moved to Michigan because he loved to build and race sports cars, English sports cars. So we had Brown chiropractic everywhere.
Yeah.
My dad also had a first cousin, who actually was the first Brown to go to chiropractic college, and he was down in Georgia. I guess I'll keep going.
Yeah.
My brother, a couple years later, decided he wanted to go to chiropractic college. So my brother Brian went to Palmer, and then my cousin from Michigan went to chiropractic college in Dallas. Another cousin went to chiropractic college in Palmer. My son decided, he was a teacher and decided he wanted to be a chiropractor, and he went to Palmer. And then also my cousin's son just graduated from Palmer College, and he's up in North Dakota.
So Palmer College knows the Brown name.
I believe so. They collected a lot of tuition over the years.
Yeah, you get like a punch card.
Yeah.
Do you think your kids, your son's son, if he goes to Palmer College, like, will it be free? I mean, after so many, geez Louise, I think how many was that? 10, 12, 15?
I lost count, but actually it's not as rare as what you might think. I have a good friend of mine, the Myler family from Western Iowa, I think, with brothers and cousins and et cetera. I think there's a 74 from that family. And there's others same way. I've got friends that have been in practice for a while, and their sons or daughters are following them. So it's actually pretty common to follow your mother or father into chiropractic and continue the tradition because they see the happiness and joy that is derived from helping people.
I see that. That makes sense. You know, I was thinking about, we were talking about it off air, and I was thinking about like Iowa, like farming, you know, like my great grandpa was a farmer, my grandpa was a farmer, my dad was a farmer. I farmed when I was a kid, but now I'm not a farmer, you know. But it was like, in my opinion, I didn't see that too often where like there was just generation. But after you said, you know, like with seeing, you know, you come home, you get done with a day's worth of work, you come home, play with your kids, and you're smiling, you're not dog tired or pissed off at the world, you know, but you're happy because your cup got filled for filling up others' cups, and your son sees that, hey, I want to do the same thing, which is pretty remarkable. And, you know, now that I'm saying that, you know, I hope someday my sons will say the same thing about me, is like they see when I get inside or get home from my work, how happy I am because I had a good day and feel fulfilled, and that they want to do the same thing. And I can't see how any son wouldn't want to do that, you know, to follow in those shoes.
It's pretty amazing that happens. But again, you know, when they see the mom or the dad are happy, the mom and dad wakes up in the morning and can't wait to get to the office to help people. And they come home at night and you go to sleep and you know you've helped people, and it's a good feeling. And anyway.
So the chiropractic journey, so you started out with your dad in Owine and joined his practice, correct? And then what time did dad end up retiring, and you're the solo man at this point?
Originally, I'd planned to come back to Owine and we'd join practice. You know, I would practice with him in his office, but a couple years into my chiropractic college experience, he came to me and he said, Brad, we get along so good. I don't want to ruin our relationship. You know, have you considered maybe setting up practice somewhere around here? And he said, I just didn't want to ruin our relationship.
Yeah, I get that.
And I said, sounds fair. So I initially started practice in Waverly, Iowa. And but the funny thing is that we kept going to classes together, acupuncture classes, practice management classes. And eventually he came to me and said, Brad, he says, we're building a house in Belize, and I want to be able to take a lot of time off. You know, you want to come back to Owine? He said, we get along so well. He said, it doesn't make sense not to practice together.
Yeah.
So in 1981, I left my practice in Waverly and we moved to Owine, and practiced from 1981 until my dad retired. It was like 15 years of practicing together. And that was moments I treasure. He was my mentor. I learned so much from him. I loved hearing his patients talk to me how much they loved my dad.
Mhm.
And that was one of the things that I strive to do is be as good as he was and be as loved as was loved.
Yeah.
And I established a single practice and stayed in that location until I built my new office in 2003, where I'm currently at right now.
Okay. Okay. Yeah, I heard you. I want to like rewind a little bit because you were saying your dad learning acupuncture. And is that typical for chiropractors?
It
It
is. It
is.
is more so and more so. And uh, I think chiropractors have found that there's so much similarity between
Yeah.
the two professions, and um, and is basically free up energy, free up life force, so that the body can heal itself.
Mm-hmm.
So they dovetail so well together.
Is that taught at college?
Different colleges, yes. My
Yeah.
first certification class was at Northwestern College of Chiropractic in Bloomington, Minnesota,
Okay.
and so it was taught there. It's also taught off campus,
Yeah.
but sponsored by different chiropractic colleges. Will sponsor the certification classes,
Right.
um, and
Can you go into it a little bit as far as like for our listeners that don't? I think everybody's heard the term acupuncture, but
mhm.
maybe don't really understand what's going on. And I mean, when I first heard that word, I just thought like, well, yeah, the Chinese do it, and they take needles and stick them in your body, and then it releases pressure. And I'm talking to a chiropractor that I think just adjusts you, and he's doing acupuncture. So can you kind of go into that a little bit?
Certainly.
Yeah.
So with chiropractic, we make adjustments to free up pressure in the nervous system to allow full expression of nerve flow through the body. In acupuncture, you identify points that need to be stimulated or treated to allow for the full expression of qi, which
Mhm.
is the energy that
Energy.
flows through the body. And the whole concept of Eastern medicine is enhancing your energy, allow and treat for the free flow of energy through the body.
Mm.
And if energy is flowing freely, then you are healthy. All the cells in your body are healthy. If there's interruption anywhere in the meridians, which are
Mhm.
channels of energy, then sickness and or disease can occur.
Mhm.
Just like in chiropractic, if there's disruptions in the flow of in the nervous system,
Mm.
whether it's in the spinal nerves or in the brain, then conditions will result, disease will occur.
Right. Yeah. No, that's again, I like your talk, how you're talking now. I just never thought in a million years I'd be having this conversation with a chiropractor. So it's opening my mind up that this is kind of normal, for chiropractors to go down this route. I know when I came and visited you, and it's a couple months ago when I came and seen you, and you were talking about this new technique, zone technique.
It balances the body to allow free flow of energy,
Mm-hmm.
to allow for healing.
Right.
So, but since I started using zone technique, um, I don't have the need to treat acupuncture points like I did before.
I guess then explain to me because now I'm a little confused. So I understand acupuncture and Chinese and getting energy to flow, which they call qi. The Japanese call it reiki or ki. I mean, there's how many different words for energy. But with the zone technique, you're saying it's a little different, but you don't have to use acupuncture as much as you did prior because you're using this technique. Where isn't there some overlap there then?
Well, the conditions, a lot of times the conditions that we treated with acupuncture um, are resolved and improved using zone technique.
Okay.
And actually, zone technique is old school chiropractic,
Okay.
completely different from acupuncture. Um, and I would say that as far as chiropractors using acupuncture, learning acupuncture, most of chiropractors I know and hang out with also use acupuncture too.
Mm-hmm.
And not that you're full-blown Eastern
Right.
schooled acupuncturist, but I use it personally as an adjunct
Mm-hmm.
to what I do. But with zone technique, I don't need to do that. I can get good results on stomach problems, um, female problems, lung issues,
Mm-hmm.
using zone technique to free up the good nerve flow into those organs to stimulate the healing and for the patient to get better.
Gotcha.
Yeah.
Yeah. Can you give us an example of zone technique on a client that where you'd have to use that versus just, let's say, adjusting their neck, or they say, I got a stomach problem going on right now, but it's also going up my spine and affecting my neck right now. Can you?
Yeah, usually, and traditionally, patients come into a chiropractor's office because they have neck pain, back pain, sciatica, migraines, and really, it's kind of a disservice because years ago, people used to go to chiropractors for a wide range of problems. I've got people in their 80s. I never went to a medical doctor my whole life until later on because we'd go to the chiropractor for everything
Mhm.
because it would help with stomach problems and sinus and headaches and they expected to get better and the chiropractor expected them to get better. But with the advent of insurance, the people in power of establishing policies with insurance limited what they wanted to pay for musculoskeletal conditions. Yeah,
Mhm.
yeah, good for a backache, neck ache, headache, but the rest of stuff, yeah, we're not going to want to pay for that. So what happened is that all those conditions that were going to chiropractors before was kind of funneled down into musculoskeletal. It's
Mhm.
still the fact today. However, um, with 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 what I do and a lot of chiropractors do, and I know all zone technique doctors do, is when they come to you, you you also ask other conditions that they may have,
Mm.
or in the course of treatment, especially with zone technique, um, you may say we're treating your digestive system, and to get good nerve flow into your digestive system. Have you had problems with itis or not eat certain foods? Oh yeah, doc. I haven't been able to have, um, you know, onions forever, and or, I've been on a purple pill. I've got no problems at all, doc. Well, oh, yeah? Yeah, I've had a purple pill and it's been keeping me good forever. So they
Right.
still had the problem. But by treating those specific adjustments to address the digestive system, you then can help that as well as back pain, neck pain. So it's kind of an entry into the office initially,
Right.
but then the patient finds out that we can do so much more than just, back pain, neck pain, and headaches.
Right. Yeah, I mean, it's crazy to like think back on like the past and time, where, you think about 50 to 100 years ago, you had a doctor that would come to your house and would see the whole family and knew everything about the whole family and all this. And which reminds me of like you were saying with the chiropractic, like people would just come to you and they wouldn't need to go to the doctor because once we hit this angle and got this fixed, you didn't need to go to the doctor, or go off to the hospital, let's say,
Yeah.
to take care of this disease or ailment, because you're hitting it from more of a root cause versus I always say a band-aid,
Yeah.
which
But one thing to keep in mind too is that all chiropractors agree that there there is a place for medicine.
oh, for sure.
You
For
break
sure.
your arm, you go to
Yeah.
the ER.
Get a bad cut down your arm,
Yeah, and there's different conditions that emergencies especially, but there are conditions that need to be addressed medically as well.
for sure.
And so there's place for good medicine. I guess the biggest thing that we're all want to be careful about is um, medicine when necessary. If it's not necessary,
Yeah,
you know.
right, or being addicted to. Yeah. Something.
opioids, et cetera,
Yeah.
too.
Yeah. Because that
But
happens.
no, and I've got good relationships with medical doctors and nurse practitioners,
Mm-hmm.
and I know their value, and I think they know my value,
Mm-hmm.
and it's all for the betterment of the patient.
Right.
I think that's how we all should look at it, is that let's work together to help the patient feel better.
Right.
And if you can do it, great. If I can do it, great. The idea is to get the patient better.
Mm-hmm.
So,
Point them in the right direction.
yeah.
Yeah. Wow. So kind of been bouncing around here, with the acupuncture, zone technique, chiropractic. Um, I didn't realize, after we keep talking here, I'm starting to connect dots, where I can see when you're saying, well, yeah, most chiropractors should be doing acupuncture. Most of the ones I hang out with do zone technique too. But seeing because they're all essentially pressure points, correct?
Well, um, well, chiropractic is not a pressure point.
Okay.
We find a vertebral misalignment that is putting pressure on the nerve that
Mm-hmm.
affects the nervous system, and which is also, I'm sure, causes pain and discomfort. And you make an adjustment to relieve the
Right.
pressure on the joint and the nerve. And actually, also what they're finding is research shows that when you make a chiropractic adjustment, it's not just getting pressure off of that nerve in the lower back; it's also stimulating the spinal cord, and that stimulation goes to part of the brain that controls that area and then back down. And that's where uh, zone technique has really reintroduced me to old time chiropractic. And and the curious thing about it is that modern research is
Mm-hmm.
supporting that. Um, you can get the pressure off the nerve, have good nerve flow, but if you have a little short circuit in the digestive area of the brain, well, it's not going to travel up to that part of the brain and then back down with full expression. It's going to get up to this point and then not
Come back down.
come back down like it should. So you need to get a good signal up and back down in order to accomplish what you want to accomplish.
Right.
I'm getting the weeds a little bit and maybe sideways a little bit, but
Yeah.
modern research is proving old time chiropractic.
Yeah. No, really. I mean, it's just I feel like that's a way with modern society right now is we're touching base on things that we were doing hundreds of years ago. It's just we're like fully understanding them now. So it's and we're going further in depth in them, if that makes sense.
Yeah.
You know?
Well, the originator of zone technique, he called it zone therapy, was Dr. Herman Fleet, chiropractor in San Antonio, Texas, 1931. So
Wow.
he came up with this technique, and that he discovered that there were points on the back of the head that correspond with different systems of the body, that there are 6 systems of the body that control everything in the body. And if you find that a particular system is out of balance, then you make specific adjustments to balance and normalize that.
Mm-hmm.
And again, that was in 1931,
Yeah.
and research just coming out in the past couple of years show that chiropractic adjustment is also a brain adjustment.
Mm-hmm.
So it's
Wow.
pretty cool.
Yeah. So with doing all of these amazing techniques you've been doing, can you share any stories of recent that you've had that stick out that are some pretty profound stories?
Yeah, there's several. And the thing is that usually the patients have come to me complaining about backache, neck ache, headaches, radiculopathy, sciatica, etc. But we also found that they had other conditions as well. A gentleman came in. I kind of alluded to this earlier. Been a long time patient, and, but I heard from his wife that he had some stomach problems. So when he came in for me to do a tune up on his lower back, I asked him about that. He goes, "No," he said, "my stomach's fine." And he says, I take a purple pill every day and I'm good.
Mm-hmm.
I said, "Well, how would you like it if you didn't have to take that purple pill?" Oh, I'd love it. So I went through my procedure of palpating the back of his head where those 6 points are,
Mm-hmm.
and I kinda liken them to they are like pressure points, um, and then there's 6 on the back of the head, and they all relate to different body systems, and zone 4 happened to show up, and that's digestive system, and I told him that, zone 4, that's digestive system, because, I palpate and put pressure on, and I tell the patient which one's the most tender, and
Right.
then they relate to me the one that's the most tender, and like it is not, it usually directly corresponds to what they're experiencing, so I adjusted him, and, I had him come back in a couple times a week for, like, 2, 3 weeks, and, maybe 6, 8, 10 treatments all, and he hasn't had the purple pill, and his stomach is fine. No matter what he eats, it is good, so,
Uh-huh.
and that's something that is that a miracle? Well, no, it's not a miracle. To him, it's amazing and it's a miracle.
Yeah,
Uh,
to many people it is 'cause
Many
they don't
people,
understand it.
but well, that he's able to eat anything he wants to without having to take a pill first. So, um, but that's pretty typical. And lately, he's been seeing a lot of conditions, sinus and lung and
Mhm.
bronchials and cough. That's pretty typical. And, we adjust and adjust the system responsible for that, which is usually, uh, number 2 is it's the eliminative system.
Mhm.
System eliminates waste and toxin from the body and bowels, kidneys, lungs, bronchioles, throat, sinuses. And typically we adjust that, and that right away they can tell a difference.
And there are points you're saying
On
are
the
on
back of the
back
head
of
that
the head.
correspond to, and, well, how do those points correspond? And it's been theorized, um, and not dissected out, that there are neural connections from those points on the inside of the cranium to the different body systems, and
Mhm.
you're able to tell which body system's out of balance. You make specific adjustments to address those,
For sure.
and good things happen. Um, a lot of babies that have
Yeah.
colicky symptoms, and I don't use pressure points for that because they can't tell me what is tender, but
Right.
usually we'll go straight to digestive system, make adjustments, and calms their colic down,
Yeah.
and the patient will, that we have under care, they'll come into my office, and
Right.
then, "How you doing today?" They'll tell me how they're doing. I lay them on the table. It's a tilt table that tilts down, and then I go to the head of the table, and they're face down, so then I palpate or touch on those points,
Mhm.
and I say, "Tell me which one of the points are the most tender today," and I go through the points 1, 2, 3, 4,
Mhm.
5, 6, and they'll tell me which point's the most tender. Sometimes there's 2 are pretty close together, so then we'll repalpate those to see which one might be the most tender.
Mhm.
So then what we'll do is find out which one's the most tender. For example, if it's, digestive system, then I will, adjust. I use an activator, adjust
Mhm.
instrument.
The clicker?
Some people call it the clicker. I don't care what you call
Yeah.
it,
I didn't
but
know. I was every time I go and I'm like the
yeah,
that's what our baby
yeah.
says, "The clicker?"
Yeah, but actually, they've done, video fluoroscopy on, activator adjustment, and you actually see the activator moving the bone 2 to 3 millimeters. So
Yeah.
it's very fast, very precise.
Right.
So, but then I'll use that to make adjustments on the corresponding areas that go to the digestive system. And then once I've done that, then I'll go back up to the head of the table and I'll put pressure on 4 again. If that's the one, I say, "How does it feel now?" And they'll say, "It feels awesome," or, "Oh, so much better."
Mhm.
And then typically they'll laugh and giggle because it tickles them that it goes away so quickly.
Yeah.
And then I do the same thing because even after all these 3 years plus years of doing it, I'm still amazed at how it works.
Mhm.
But then I raise the patient back up, and and good things happen.
Well, in all those cases, and I guess you could probably, revert this to all of your patients, is the lifestyle change that your patient gets to live now,
Well,
you know?
it is profound, and
Yeah.
every chiropractor has their miracle cases.
Yeah.
That's one thing that occurs. I find that, so quote unquote, a miracle cases happen a lot with the zone technique. And I
Mhm.
fully suggest that chiropractors check out zone technique.
Yeah.
And Dr. Pete Goldman um, is the one that he's been a student of it for since the 90s, and he teaches it, and he's got a great curriculum. You can
Yeah.
go on YouTube and pull up zone technique.
I remember coming up to you, and I remember you doing it on me, and you hit a point. I don't remember which point it was, but it was uncomfortable. It was like, yes, that point is definitely a lot tender than the other ones. And then you did your thing and you come back to just check it again to see how it feels. And I remember you hitting it again and it felt like you were like tickling me, or like barely grazed it. And you're like, well, I was actually pressing harder than I was initially, I just couldn't believe you because I'm like, "No way," "That's like tickles. How does that even happen after a quick little adjustment?"
Yeah,
But
sometimes the points you put pressure on the point, and it'll be like stabbing a needle, even though I
mhm,
have with a light touch on it because it's that painful. And sometimes it gets to the point with the patient that I've seen several times that it doesn't hurt, but you can feel it more.
I wanna dive into you when you were going over to the East and how you've incorporated now all of these East or were they East practices or were they West practices? But you heading over to China to learn, Qigong and all that, and how that's helped you out with your practice as you've been practicing for how many years,
47.
47
Yeah,
years.
yeah, it'd be 47.
Yeah.
Um, yeah, so again, my father started taking classes in acupuncture back in 1979 when he wanted more help helping patients with knee issues like osteoarthritic knees,
Mm,
et cetera, more than what adjusting the knee and adjusting the spine can do for the patient. So that's when he got interested in acupuncture. So that's when he started becoming certified in acupuncture. At that point, he used actually, it was a laser. It's a laser that is less powerful than the lasers today, but it was used to stimulate the acupuncture points because we couldn't use needle acupuncture at that time. Since it has changed that we can use needles
mhm.
if we choose to. And again, with acupuncture, we talked earlier about acupuncture itself, and that's kind of a misnomer because it automatically you think about somebody coming at you with big needles to stick in you. Yeah, acupuncture, it's not a technique, it's, basically a philosophy of identifying those points that need to be treated to, re to ensure the free flow of energy, qi through the body, and that can be done with a needle, and that's the first thing that was brought on over in the 1970s, and people saw that on TV, so everybody associated the acupuncture with needles, and they still do, but
Mhm.
you can stimulate acupuncture points with laser, with electrical stimulation. A teishin it's a non-piercing instrument where you tap on the points. That's very commonly used. Um, Finger pressure,
That's what I was gonna say,
shishin,
yeah.
that's called as finger needles, and you can put pressure with your fingers on the different points. Um, you can put beads on the points in the ears or on the body, which will stimulate the point. Um, the key thing is, I've even used uh, toothpicks. On one of my trips to China, somebody's having some issues with the stomach, so I used one toothpick in the back of a plane flying to Beijing, and on a person, another chiropractor was having some stomach issues, and this 4 foot nothing Chinese lady, about 90 years old, came back and she looked up at me because she had to look up at me, and she said, "No," she said, with 3 fingers. So she wanted me to use 3 toothpicks. So I put 3 toothpicks together and able to stimulate points that way, and it was more effective and less painful. Anyway, so I've used butter knives, I use car
Yeah,
keys,
yeah.
you can use touch. So the point is just stimulating the point. And how I do it now Rarely use needle. The last time I used a needle was helping a gal who has had a breech baby.
Yeah.
I treated some points there a few months ago. Occasionally, I'll use electrical stimulation. Just have a
Can you
couple
use
patients.
sound?
I had an infrasound machine years and years ago that
I'm thinking of like ultrasound, like
yeah,
for
you can
like
use oh yeah, you can use ultrasound.
yeah,
Absolutely. And they have different I think different endpoints you can put on the machine to
yeah,
focus it.
for more like narrowed
Yeah.
precision.
And actually you can use tuning forks too, I would imagine.
There you go.
Yeah.
There's the sound.
Yeah, you
Mhm.
can just in the vibration and the sound.
Uh-huh.
So I imagine that's very effective
Yeah.
for treating acupuncture points. And
We do that. I didn't even like think of it. We'll do that sometimes,
yeah,
on their feet and stuff, the meridians on your feet, even your hands
yeah,
and
and you can
stuff.
use, you can touch
Oh,
those points with your finger, and you can
yeah.
use Reiki or
Mhm.
Qigong. But so what got me interested in acupuncture was my dad originally,
Mhm.
but I became quite a xenophile. Uh, all things China, Chinese medicine,
Yeah.
multiple certifications over the years, different places. Auricular therapy, which is ear acupuncture, choreo, which is Korean hand acupuncture. And I used a lot of that along with the chiropractic adjustments. And again, I don't profess to be an acupuncturist.
Yeah.
That's a whole profession that
Mhm.
deserves its own respect.
Yeah.
But I do use acupuncture and meridian therapy and Eastern principles to help me
With your
with
chiropractor.
with the chiropractic as an adjunct to the chiropractic and as a
Yeah.
way to understand and help the patient. Um, so in 1998, I received a brochure in the mail that the Chi Institute from Costa Mesa, California, I think is the town, was setting up a trip to China to study Qigong. And I'd heard of Qigong, didn't know about it, so I did some quick research. That might have even been pre-Google, and I thought, "Oh, this is cool."
Mhm.
And, Qigong is a way of bringing Qi energy into your own body and circulating it through your body to, uh, to clear the channels of energy, to increase your energy, um, and medical Qigong is being trained to be able to use that to emit the Qi energy to your patient, to help,
Mhm.
promote healing.
Mhm.
And so I asked my wife, and she says, absolutely. My dad would still practice, and he goes, I'll cover your practice. So was gone 17 days. It was a 2-week intensive Qigong experience and actually it was a research project as well. And the research project was, what is Qi? Can Qi be measured? And secondly, is with an intensive 2-week intensive, can you increase your ability to create that Qi, which is pretty darn cool. And so there was like 44 of us that went over, and I didn't know anybody. I just landed in LA and stayed at the hotel where it was gathering. And there happened to be my acupuncture mentor and his assistant and a couple other people that I'd never met before, but they were chiropractors. And so we flew over to Beijing and we stayed 2 weeks and we were treated multiple times. We did Qigong exercises. We ate completely a vegetarian, which was a new experience for me. And but in order to have clean energy in your body, and did testing using Kirlian photography, which and we used it was a way of you put your hand in a box and there's photographic film in there,
Mhm.
and you're able to then we were told to basically push chi out of your hand, your healing hands, and we'll measure it. And you're able to see, I do that for a period of time, and then you can look at the picture and you can see um, electrical impulses
Yeah.
that you generate. And then we did a 2-week intensive. We came back and retested again. Also, we went to a big building, and it was Chinese Electrical Acoustical Institute, and there was a doctor, Lou, I think his name was, who was the head of the electroacoustical research. He was also the top, I found out later, the top scientist for the Chinese spy satellite program. I found that a few years later.
Whoops.
When Master Wu, who was also General Wu, who was our chief host.
Yeah.
So we went into anechoic chamber, which is a huge room, soundproofed all around. We laid on like a spring trampoline, but it was the size of like a baseball diamond, and we had a wire coming down with a probe on the end, and we laid there, and we were told it was to pick up infrasound. So we were told to push out the chi as much as you can, and they measured it. So, to make a long story short, we did the 2-week intensive, came back, and they remeasured it again, and basically everybody, not everybody, but most everybody increased it somewhat.
Right.
And I happened to be one of the ones that increased it the most on both the Kirlian photography and the infrasound. So that was really interesting, that you can actually increase your ability to heal your hands by those exercises. An interesting byproduct that we learned from the Kirlian photography is that those that had that did Reiki, because there's Reiki practitioners, massage therapists, chiropractors, the people who did Reiki, the energy that came out of their hands electrically was more of a softer glow. And the people that had a lot of martial arts training, they had a lot sharper, lightning-looking
Energy
coming out. You could actually see it in the photo.
Yeah.
But that was interesting.
It is interesting, like, because, I do energy work and Reiki and some other energy work, and I can feel that when I can distinguish between the two, like what Reiki's very, very loving and soft and gentle, and then you can go in like Qigong or Qi. There's some other Egyptian energy work that I've been diving into, and it's a lot more pinpointed, where you can really ramp it up and push it where you need to push it, and that reminds me of that is there's just different energies, but going back to like Reiki is like, I reiterate to people is like, it can do no harm. It's so soft and so loving. Yes, there's other energies out there that can, but it's, it's so loving. So it's interesting you say that. When they're measuring it over there too, you could definitely see with their hands.
Yeah. And one of the things we did too is I think it was towards the end of our 2 weeks over there when we've had a lot of training and basically brought up to speed, quote unquote, I guess. We went to a village up into in the mountains outside Beijing, and there was a poor village up there, and they don't have Western medicine, and they have very rarely Eastern medicine where they were. But it was set up ahead of time, and we went there. There were chairs set up, and the villagers came in. And an interesting thing is that this older lady, older meaning I'm 71, so older, she was way old. She was about 80, so that's not so old anymore to me. Anyway, but she looked like she was like 95. She couldn't walk by herself. She had her 2 sons on either side, hobbling in, and she'd been like that for, long time, months and months. And anyway, so she was brought to us. There was 3 of us that treated her, and we stood around her, and we practiced medical Qigong of accessing the energy and putting energy into her for the purpose of healing. I don't know, 20 minutes or so of doing that, I think, maybe 30 minutes, maybe not that long. And at the end of it, she thanked us, and the two boys, hobbled her out. And we're thinking, well, hope she gets some help out of that,
Mhm.
don't know. Next morning, we were there, and she came walking in with her sons walking behind her.
She's
And
not
came and
hobbling.
no, not hobbling. She felt great. She was walking. She came up to us and gave us a hug, and just like a miracle had happened,
Yeah. Mm.
And um,
Yeah.
yeah, so that felt good.
Right.
And
Did you at that moment, were you skeptic about it at all, like, going into it?
not no, I
And
wasn't
then
skeptical at all.
yeah,
So the only thing that it was just number one, how much could I do?
yeah,
If I've been trained to it, and
mhm,
how much could it do?
yeah,
But I was, I had a strong feeling that yes, it will help. But it's like, feel good, oh yeah, I can, that helped me,
mhm,
I had no conception that she'd be able coming in, strutting in like she did with a big smile on her face.
that's
Um,
amazing.
yeah. And again, as you know, and
Yeah,
being in the healing arts,
yeah,
when somebody comes to you that is in pain or sick, and then you treat them and they come back and they got joy in their face and a bounce in their step.
yeah,
That's fulfilling.
it is.
That is
Mhm,
fulfilling. It's really cool to help people.
mhm,
And again, I don't promise a cure. I don't promise anything.
yeah,
Although, um, if I expect that I can help a person, I'll sure tell them that. I
mhm,
expect I'm going to help you. We can help you,
yeah,
but I don't I don't purposely court people who have seizures to
right,
come to my office for treatment
right.
of seizures.
Yeah. Yeah, no, that makes sense. I like how open and honest you are about it. And I think with today's podcast about this, I mean, going into it was, well, Dr. Brad Brown, the chiropractor. And after we've been talking, it's been a lot more than just chiropractic, you know? And I think that's important for all the listeners out there that do listen to this podcast is that if you do think something feels off and or, maybe like a stomach issue, I know you're not saying seizures and stuff, but there's a lot more going on to than just adjusting your neck or adjusting your back when you're coming to see you. I mean, there's a lot more, you know?
Yep, absolutely. And the body can be broken down into those 6 systems of the body that
Mhm.
zone technique addresses. The glandular system,
Mhm.
which secretes all the hormones and glandular secretions, and it affects the immune system. And that zone number 2 is eliminative system. That's a system eliminates toxins and waste from the body.
Mhm.
Um, and like bowels, kidneys, lungs, bronchioles, sinuses, throat.
Yeah.
3 is the nervous system, and that includes the peripheral nerves and the brain. See a lot of that with people that have a lot of stress, a lot of tension,
Mhm.
a lot of pain in the different nerves too. 4 is digestive system,
Mhm.
the ability to digest and assimilate nutrients. You know, bowels, liver, stomach, gallbladder,
Mhm.
etc. 5 is the musculoskeletal system, all the all the tendons, muscles, ligaments, joints in the bodies under that system, and 6 is circulatory system, um, heart, blood vessels, etc., etc. But
Mhm.
every system or every tissue in the body is within one of those 6 systems.
Yeah.
And if you determine that there's an imbalance in that system, and you make the proper adjustments, then you work towards normalizing the function of that system, and then health can certainly follow that. Certainly,
Yeah. Balance,
yeah.
you know?
And one of the big things too that I do want to address is, um, one of all the things that I've studied ever since I got out of chiropractic college is um, the power of positive thinking. Um, And what you believe, you can achieve.
Mm-hmm.
And that's one of the biggest things that I've learned over the course of time. I studied with the Pacific Institute and Louis Tice, neuro-linguistic programming, which basically is self-talk, to change how you think about yourself.
Mm-hmm.
What you say to yourself is so important. What you say to your kids are so important. Again, if you're told you're never going to amount to anything over and over again, what's going to happen? You're not going to amount to anything because you have that concept implanted in your subconscious.
Yeah, you're believing
And the
it.
same thing with illness and sickness. If you've had a cough when you were a kid or had some lung issues when you were a kid, and you were told that you're always going to have those lung issues, you're always going to have that, guess what? You're always going to have it.
Mm-hmm.
And it's hard to get over like a physical condition when your subconscious tells you you're never going to get over that. So part of what you have to address with patients certainly is the expectation that they will heal.
Mm-hmm.
And that subconscious to subconscious communication that the doctor has that I expect you to heal. You're gonna have perfect elimination, no bowel issues at all, and there's subconscious to subconscious, and subconscious accepts that. That drops into their conscious brain, which goes into the body.
Mm-hmm.
And that's a big part of zone technique. That is a big part of zone technique is addressing the subconscious thoughts, because our subconscious mind determines our body.
Mm-hmm.
And we have to have a positive expectation of health.
Yeah.
And if we don't have that, then you're not going to have full, complete health.
Mm-hmm. Yeah, I was thinking about that, because I can see some similarities of what I'm doing and what you're doing. When somebody works through a traumatic experience, like let's say childhood trauma, and it's implanted now in their subconscious mind, and they just can't get it, and it's stored in the body. Now, I've had a couple cases present this to me lately where I can see them getting ready to release it, and their body starts, shaking, the nervous system does because they're holding on to it and they want to release it. Like, do you have anything like that happen to you when you're doing any type of work or anything where the body does hold on to a certain, uh okay, going back. Subconsciously, they're holding on to something, let's say like the stomach or the girl that was having seizures. And then her body is now causing to shake and to do this stuff. Now, when you go in and adjust her or move her, does her body like twitch or do anything differently while you're adjusting them?
I haven't noticed that.
Yeah.
But again, a lot of the treatment and the chiropractic adjustments, the zone technique treatments, just take a few minutes.
Yeah.
It does not take a long time to do that.
Right.
It's very pointed, very specific, and um, but it's very profound.
Yeah.
Now, one thing is, I probably from a zone technique point of view is if you can change when you change the subconscious concept in, let's call it the patient's
Yeah.
subconscious, from I have a stomach problem to the possibility that I'm not going to have a stomach problem.
Right.
And then so that concept, that negative concept that's been in here is replaced by the concept that's floating out here of I have perfect stomach health. And when you implant that in the brain and that takes the place of the negative concept, then that's when it drops into the conscious and the body experiences the healing.
Right.
As far as anything like you've told me about,
Yeah.
I haven't experienced it like that.
See, I didn't.
That you
Yeah.
have in yours.
Right. If you did, where I've seen it, and I've a bunch of other video I've seen like where our body that's what's kind of interested me about massage therapy or just touch of the body is because when our body stores these emotions, which can be held from a subconscious thought, and once we release that subconscious thought and change it, it's still in the body, and the body needs to send it out, but the body will start to shake or tense up because it's like its last straw. And then once it releases it, that's where I was wondering, like, if you notice that at all in chiropractic, but I guess your point being is it's so quick and fast that you don't really get a chance to see
Well,
that.
if it happens immediately,
Yeah.
does it happen immediately when you do that?
No, it's gradual. It's like very like slowly where you can see it wanting to come out, and you can
Yeah.
see there's the change happening, but it's like the body holds on and resists and shakes a little bit. And then once it releases, the breath calms down, the body calms down. You can see the mind, even after the session's done, their mind's completely shifted. So that's what I was saying is like a lot of that what I've noticed is stored in the body, a physical ailment.
Mhm.
But I guess your point, what I'm seeing is like it's more pinpointed to where it's happening quickly, where this is like gradually, but I think it's kind of the same. We're going to the same destination.
You know what?
You know?
What might be a fact is that a person who needs help can find himself to the health practitioner
Mm-hmm.
that's going to help them.
Right.
And maybe for what you are seeing,
Right.
those people need what you're doing.
Yeah, exactly.
But again, the concept is you clear that bad negative concept out of the subconscious,
Right.
and then that opens up to healing.
What if somebody, like, I'm thinking of like the cancer patient, that has been going through chemo and battling and battling and battling, and it's just like
I've got
y
several.
exactly,
I've
yeah,
got several that are
yeah.
doing that.
Do you have, like, some tips or tricks of,
Well, no tips or no tricks,
Yeah.
just that their body is going through chemo.
Mhm.
You got the emotional trauma, you got the physical trauma, and which negatively affects the body and the subconscious.
Yeah.
But I've got several patients that are taking chemotherapy or have taken it, but currently under chemotherapy. But by analyzing the body's own techniques, see which body systems are out of balance, making
Mhm.
adjustments to balance those body, it will help them feel better. It will help them
Right.
deal with
Process.
the trauma of the treatment, which is chemo is very traumatic. And so they've helped them feel a lot better and deal with it better.
Right.
So of all people, they probably need it more than anybody to keep their body balanced and good nerve flow and brain function to have good body system function because they have so much going on with the chemo.
For
So
sure.
yeah, no tips or tricks, just the zone technique treatment.
Yeah.
Um, and I rarely say, I think I can help you.
Yeah.
And the reason why and is because that by think I can help you
Yeah.
kind of implants in the patient's brain that, well, maybe not.
Right.
No, I'm not saying that I don't say that. I might say it a little differently. Like,
Mhm.
I think we gave you good help,
Mhm.
but most vast majority of the time is I tell the patient we can help you. I
Yeah.
expect that you're going to get better.
Yeah.
I don't know if you're going to be 20 years old again,
But we can
but
help.
we're going to help you,
Yeah.
and we're going to as close to that as we can.
Yeah.
Patients that are 20 years old or 30 years old, I just had a young gal the other day. She's been hurting for years, and I said, "You're much too young to feel that old. Feel that we can help you." And she was thrilled to hear that. And I thoroughly believe that, of course, the treatment, she's going to feel a lot better. And when you're a young mom with 5 kids, that's a plus.
Yeah,
Yeah.
because we know kids,
Yeah.
raising kids are a lot of work.
Yeah, and I think just thinking here, a random thought though, it's not really random, but one of the key things for a chiropractor or any health practitioner is to establish a good rapport with the patient.
Mm-hmm.
You know, talk to them, sit down
Yeah.
and talk to them, so that you understand what their problem is.
Mm-hmm.
More importantly, so that they know and understand that you know what their problem is.
Mm-hmm.
And secondly is that you can help them.
Mm-hmm.
So establishing that rapport through fascination, meaning that, oh, that's cool, let's do that,
Yeah.
open to it, or um, or belief that they believe you, that you can help them,
Yeah.
but that's key towards establishing the healing path for the patient to
Yeah.
develop that rapport.
Mm-hmm.
And I tell a lot of young docs that, patients don't want to hear how much you know.
Mm-hmm.
They just want to, I'll rephrase that. Patients don't care how much you know. They just want to know how much you care. You've probably heard that phrase before,
Yes.
and that's so true. They
Yeah.
don't care about that, and
Mm-hmm.
how smart you are. They just want to, can you help me?
Mm-hmm.
You know?
Yeah, I see that and how much of that
Yeah, and
goes
do you,
along.
and do you care?
Yeah. That's where I was gonna say, just in our medical field in general, whether it's the hospitals or chiropractors or dentists or teachers or, whatever it is. I mean, you can sense that. And you were talking about, like, with zone technique, like the power of positivity and just planting those positive thoughts out and what they can do. And people can sense that, if I'm going to, the hospital and getting my routine checkup and the doc's just in and out quick and doesn't ask me any questions, but the nurse is in there and how's your day going? And what's going on? And sometimes that's what I feel is like the nurse is giving me all the love here, but come on, doc, like you need to give me some love too. But I get what they're going through now that I'm in this industry now or helping people, is that you see patient and patient and it can get exhausting, but it's important to remember, like that in my book is like the number one is just how you're presenting yourself to your patient and are you really there with them,
Yeah,
you know?
that is critical. And I just
Yeah.
had a patient come in, and I forgot, I forgot what type of doctor he went to or she went to, but she told me that she went in and sat down to talk, and it was quick, but he didn't look interested at all in what she was really saying. Like, it
Mhm.
wasn't registering, it wasn't thinking. So that was the last time she went to that doc.
Right.
Like, I want somebody who's going to listen,
Yeah.
who understands what's going on, and who I think cares.
Yeah.
And she said, I didn't really, at what she says, I didn't really think he cared. And I
Mhm.
thought,
Yeah.
that is not good.
Yeah.
That's one thing too. I tell young docs when we talk is that you got to stay fresh,
Mhm.
and that applies to any type of health provider.
Yeah.
You got to stay fresh,
Mhm.
because you got to, Sunday night comes, you got to be rip roaring to go back in the office on Monday and help patients.
Mhm.
Um, if you work long hours, without vacations, it's
Yeah.
going to wear on you. And but stay fresh, and if you stay fresh, enthusiastic, uh, you're going to stay in your chosen healthcare field a lot longer. And you're exactly.
Just
And
like you,
well, yeah,
I mean, and
you got to schedule
that's
vacations. You got to
yeah.
schedule your hours. I've been working 3.5 days a week for several years now.
Yeah.
Before that, 4 days a week, but I was taking a 3-day vacation
Yeah.
forever, and then taking several vacations throughout the year to stay fresh. Uh, Otherwise, you're going to burn out, and you're going to retire before you should retire, and because you just dread going to the office.
And you can apply that in any industry.
Yeah,
I mean, think about that. Like that's I think those are the words of the podcast is you got to stay fresh.
yeah,
And I mean, parenting, being a teacher, whatever it is. I mean, think about that. If we would all just stay a little fresher, how well our work would be and how people would be excited to come and see you, you know, because they know you're giving them the 110% that you have, you know, versus like, oh, great, I'm the 34th chiropractic adjustment for the day, you know, it's, you know, but if you're fresh and you're on top of your game, yeah, you can see all those. But the guy that's seeing, you know, how many patients every day, all day, forever, yeah, it just,
Well, if you can
you
see a
know,
ton of patients in a day, a ton of patients in a week, but if you have, I take a 2-hour lunch.
mm-hmm.
I'm done at 12. I go home and I grab a quick bite or energy, like green drink or something, and then I take a 25-minute power nap every day, every day, every day. And this is kind of a funny story. My cousin Jeff, who's a chiropractor in North Dakota, when he was a young boy, like 4 years old, he was 10 years younger than me, maybe. He came crying. Christmases was all about chiropractic. There was 4 brothers, a family, going to Grandpa Grandma's in the farm in Esterville. But Jeff came crying. He's like 4 years old, and he said, I can't be a chiropractor. And his dad said, well, how come, Jeff? Because I don't like to take naps. Well, I think he's learned to take naps. He has learned to take naps, and that's a good thing. So I recommend that to my patients. You can take a power nap, re-energize. Chinese recommend reset, close your brain down, and then you're ready in the afternoon to go back and whatever you do for a living, you go back and hit it hard and focus.
Yeah, the days of working harder, not smarter, I think, are coming to a close. You know what I mean? And you're seeing that.
Yeah.
Like, and what you've said, I mean, just throughout this whole podcast has been, I've learned a lot. I mean, I've learned a lot, Brad, and you know, off air, he was saying, I don't know how we're going to talk that long, Justin, but, you know, this guy can talk.
Well, I told Teresa, I don't know that many words to fill up, you know, a half hour or whatever time.
Well, I don't even know. It's been an hour and 20 minutes, so I think you can talk pretty good, Dr. Brad Brown.
Yeah. Well, and there's so much we can go over.
I
you know. It's like, I've been doing this for 47 years. I've loved every minute of it. Wouldn't change a thing.
Are you going to be coming to a close anytime soon?
You know, Teresa and I came back from one of our trips last year. I think it was Mexico. And I came back and said, you know, Teresa, I decided I am going to retire. And instead of like dropping dead of a heart attack over a patient when I'm 100 years old, I'm going to retire at some point. So right now, I am looking for the perfect fit for somebody to come in and work alongside me, and then maybe cut my hours, take more vacation, and then transition. But it's got to be the perfect fit. Somebody who does what I do, who's personable, and loving, and caring.
For sure.
And so that when the patients are face down and being treated by new doc, there's no difference between new doc and old doc.
That's awesome.
How long that'll be, I don't know. You know, year, 2 years, 3 years, we'll just see. I love what I do. I'm healthy. I don't hurt. I don't have any problems. I don't have any health problems. You know, I feel great. I feel like I'm, you know, like I'm 50 or maybe 60.
Well, what I keep hearing is it's a legacy, doc. You know what I mean? Like what you're doing, just everything you said there. It's not just selling a business or selling your practice. You need to have the right fit because you do care that much about your patients. And that says a lot about your character and who you are. And, you know, I'm thankful for today. I know our listeners are. It's been a great show. Do you have any final words or anything you'd like to touch on?
You know, not that wouldn't take probably another 30 minutes. I'm teasing. Listen, it's been a pleasure talking to you. Yeah. Pleasure talking to you. And you've been a good friend.
Yeah.
So anyway.
For sure. Yeah. For all our listeners out there, if they want to reach out and contact you or anything like that, I'll leave a couple links in the show notes on the zone technique, a little YouTube thing to click on if you want to hear more about that. You can reach out to my Gmail and then I can point them into your direction.
Yeah. And actually, my office number is area code 319 283-1621.
Okay.
And you can text or you can call.
Right.
If you want to schedule an appointment, consultation at no charge, feel free to.
Right.
If you're a practitioner who wants to learn more about zone technique,
Yeah.
reach out. I'd be happy to chat with you.
Yeah.
And it's been a pleasure.
Thanks, man. This has been awesome. I appreciate it.
All right.
Thanks, Brad.
Thank you.
All right, guys. Thanks for tuning into today's episode. We hope you enjoyed it as much as we did. And remember, hit the like and subscribe button. And if you have any questions or anything, don't hesitate, reach out to us.